And it's 8:43 a.m. We're checking in with a physician who is originally from Newfoundland and Labrador, but they're currently based in London, Ontario. Actually, Dr. Michael Hart was the first physician in London, Ontario to open a cannabis clinic. He's been a huge fighter against the stigma that exists around medical marijuana, and he joins me live on the phone right now. Good morning, Dr. Michael Hart.
Thank you so much for having me. I really appreciate it.
Does it make you miss home or what, talking to VOCM?
Absolutely. I love the accent.
So, I mean, tell us a little bit about, from your standpoint, has it been a hard-fought stance that you've taken in terms of weeding out the stigma around cannabis?
I think that it's gotten slowly a little bit easier as things have progressed. I mean, now that things are legal, I think that the stigma has really decreased, and I think that a lot of people are using cannabis for medical benefits, and a lot of people, see and recognize that cannabis does have a lot of medical benefits. So, I think that slowly the stigma is being decreased.
So, I mean, recently I saw something flash through my Facebook feed that said experts are finally admitting that parts of cannabis, I'm not sure which parts, but they would actually help when it comes to a cancer diagnosis. Is that true?
So, I mean, the thing with cannabis and cancer is that, we have a lot of evidence out there right now that, cannabis can help treat a lot of the symptoms of cancer. And we also do have some animal models that show that cannabis can actually treat certain cancer tumors. But, we certainly can't come out and say things like, cannabis cures cancer or anything like that. I just don't think that we're far enough ahead in that type of research. But we can certainly say that it can help treat a lot of the symptoms, and we can also say that, in the future there is potential that cannabis may be, a therapeutic target for reducing tumors and actually helping treat the cancer itself. And
who are the people that you treat in your clinic? I mean, is it people with epilepsy? Is it people with cancerous tumors? Who needs medical marijuana?
So, I mean, I treat, various types of illnesses in my clinic, but, the big things that I think people are using cannabis for these days are chronic pain, sleep, so insomnia, and then also to anxiety and mental illness. So, when it comes to chronic pain, I mean, a lot of people have been able to reduce the use of opioids and NSAIDs with the use of cannabis. So, that's been really helpful for a lot of those patients. And in addition to that, the patients who have trouble sleeping at night, a lot of people have been able to come off a lot of their medications, using cannabis, and they find that, when they use it properly, they wake up the next morning and they feel much more refreshed. They have a lot more energy as opposed to when they're using their sleeping pill, which sometimes can make them drowsy. So, there's a lot of different indications for cannabis, but, those would kind of be the main ones that I would use cannabis for.
And Dr. Hart, we had somebody on here from the NLC, and even though you're in London, Ontario, I know you know what that means because you're from here. So he was on here. All right, you know the lingo. But he was saying that when it comes to CBD, there was more seniors stepping forward and saying, give me that CBD oil. So I guess my first question is, what are the seniors using it for?
So, as we know, polypharmacy is a big issue amongst seniors. A lot of seniors just aren't on one or two medications, and sometimes it's not even, 4 or 5. It's, 8 to 10 medications. So, CBD is a great medication for a lot of those particular patients because it does have so many indications. So, like I said, it's used for chronic pain. A lot of elderly people have chronic pain. It's also used for insomnia. A lot of elderly people don't sleep that well. It's also used for mood disorder. So, a lot of people who are elderly, they have some anxiety, they have a lot of depression. So, CBD can be effective for all those conditions. And I think that that's why there's a big demand from the senior population. It's because, they're basically, sick and tired of using so many prescription medications, and they just kind of want to simplify their life, simplify their routine and their medication medications and their treatments. And, when you use CBD, you can treat so many different ailments just with one medication. So I think that's, part of the reason why so many elderly patients are using CBD. And, also too, I should note lastly that, there's very few side effects with using CBD as opposed to a lot of the medications that the other seniors are using. So, I think that's a big attractive point with the CBD in that particular population as well.
And you don't get that euphoria. It doesn't sort of mess with your mind, right? Is that true?
Correct. So THC is the cannabinoid that does give you that euphoria that can, possibly interfere with short-term memory while you're using THC. But when you're using CBD, you don't get that euphoria. So it doesn't act in the same way as THC. It doesn't make you high. So because of that, it's safe for things like going to work, driving, reading, writing, doing whatever you want. It's not going to interfere with your cognition. It may even, in fact, just increase your focus. If you're someone who has some anxiety and you can't really focus, using some CBD oil sometimes can, in fact, reduce your anxiety and allow you to focus. So, it can be really effective for some people during the daytime.
And Dr. Hart, as we move towards legalization of edibles, topicals, and extracts, so edibles you eat, topicals you put on your skin. What are extracts?
So extracts are basically a concentrated form of cannabis that, it can be used medicinally. I think some people are abusing it recreationally, in my opinion. So, an extract is something that people can dab with recreationally. So that's when you get a really, really high concentrated form of cannabis that can be inhaled very, very quickly. So, that's not the way, the medicine was used before. So we really don't know, the long-term side effects of that. So, for myself, I'm against dabbing. I don't think that people should partake in that. But, if you can get a concentrated form of cannabis and, put that in a trusted vaporizer device, that can deliver medicine, that absolutely is a different story. And that may be effective for a lot of patients.
And in your area of expertise, as, somebody who supports medical cannabis, are we ready for the legalization of edibles, topicals, and extracts now?
Yes, I think that we are ready for it. I think that we've already had the legalization of the bud and the oils, and it's time now for everything else to become legal. Because if we don't, I think that the black market is just going to grow. I think that a lot of people are still really interested in using gummies, using different edibles, using different topicals, and I think that there's a lot of people that are still going to the black market for that. So why don't we make things available for everybody so that they don't have to go down the road to the dealer? They can just go to an established store and go in there and buy a product and with confidence. I think that'd be much better for everyone involved.
Excellent. Dr. Michael Hart, thank you so much for checking in with us. And before you go, when are you coming home again now?
I'll be home Christmas time, and I'd love to come on air then again as well.
Well, I'm going to hold you to that now.
Okay.
All right.
Perfect.
Thanks so much. And one final yes bye for you before you go back to your life in London, Ontario. Yes bye.
Yes, bye.
Yeah, exactly. There you go. Thanks so much.